free what actually do our health sector anymore? These policies and plans idea.
Yeah, Eddie Gaino, let me say a very good morning to her for your TFO, you know, and my BBH in Mechia Vidaka South, constituency for name original chairman, Nakwasi Andrews, and then Charles from Gonzo Free. His Excellency John Dramani Mahama, the president in waiting, Emma Asantamine Ghana Funina. Maybe there's a what really is the issue? The issue is that so what's your mind more? Na or might be Ghana resource be by your way, you know. Now we share your life expectancy rate. Of course, in the sub-region, you're extremely bad. But I'm not sure, say, given the opportunity, no, I want to say Ghana ni ya wono akra ngea ya kasi wenya 64, 65 years. When other countries are doing 75, 78.
Meaning that maybe
exactly. It means that I was buying any focus on where it matters most.
Okay.
And there is a lot of evidence. I don't see a baby actually say, you focus on primary health care.
Okay. Primary health care, any day.
Any day. You can primary health care. You sharp dia ne fa pempa ne sipim no. E focus on nipa no. Nti wo have prevention. Wo have curative. You got curative na. Oh nipa na yare afi ne ye kwa kope na yare ne yare sani ade. Dabi. You focus on what? Prevention. Nti wo bota in when is what hu nyina say at the individual level no, at the community level no, apomdin be sipim. Ube memu ado. Se ne be ya nipa bebre case bebre de ba comfort no che de ba regional hospitals no. Aso beti. Eba sa at the equity eba. I didn't think the equity ba. Dia wote dumachi e wa fija kwa Abre South. Obeya ba bia akọ ayarohwe. Dia wote mponzu e wa fija kwa Abre South. Obenya ba bia akọ ayarohwe. Dia wote edwureti ya me ma me beti mo reduce krum. Easy access. A science so the effectiveness eba. Into Mahama, we health na policies na person wade bana. Se Ghana form na kwanya. There is a synergistic relationship. We eko rawe mu na we yako rawe mu. Entina okas obesi a big center e be focus on non-communicable diseases.
Okay.
Because o man bia no health no ya pombo no o transition omanfo na bra ba ba be sedentary bi se wo tie obetena haza kopem minim ayi a obepon akofie bedura najo wadidi omanfo na bra bo no ba be sedentary lifestyle no na the non-communicable disease bi say cancer e bi se den hypertension no ene sa na na ba but oman yen share dan en committee ye ho say ye be focus on sa na no enti say ye primary health care na and no focus ni be a health education, a be a health promotion, a be a malaria care no community level no. You share near prioritizing no. About expenditure on health to be reduced.
And how is it going to be done? Through what means? Mube deploy nipa na alcohol, and I say mube station nipa honma brano mbe sa ne manu nyina.
Me no ka say. NDC. Unim say chips compound is na dey buy. Ebiana winim.
Minim.
1994. Chips compound a operation. A fully operational no under 50%.
Okay.
And this is Ministry of Health evidence. Anti opesa we here primary health care. Health no must be accessible to the people there. So what we are going to do when they say chips compound be brain na any operational, we put them into full operation.
Okay.
We build enough health centers. Once the Edika said we're going to have invested $10 billion
US dollars
into infrastructure. On the road, health, I was somebody say MPP are buying budgetary allocation ya no. Less than 7% of budgetary allocation is going into health expenditure.
Okay.
It shocks you, eh? My more figures be. Senator ya Obehun say this year budget more approved for Ministry of Health no. Bear roughly 15.7 billion. So 15.7 billion no. O compare last year and this year what?
Last year
last year 2020
23
22 23 no. Any afu no. As what it because I buy no priority for health no form.
Okay.
Health insurance ka na o senka o de ma wo na preventive health no mo ye no. What the ye niam afoforo. And for the first time in the history of this government, but let me so him say health insurance fund and send this in establish it. Yes, in 2012, the NDC established that. Now we don't brag about it because we say basic. You know, health Ministry of Health na ankasa budget expenditure KPS no percentage of KPS no here very low. In fact, it is just 7%. Sika abaye no afiwe wasu obetwa na wade yakọ capital expenditure nye health no health no budget ni nyina no the other beko capital expenditure is 7%. The NDC under John Mama will reverse that trend. So say primary health care no your priority ya. The one need chips compound also see be man wo ho. Now the public health nurse and the community health nurse eko down no. With the midwife ekoto no. The only polyclinic no woman physician assistant ekotena ho. Sani ebeya health will be closer to the people.
People say it's easier said than done. Say you say assembly no ho na say assembly adanse no ye twa bi ho ene dey adanse. Eba healthcare ya ho we talking about health insurance and chroniba.
Yeah.
People had issues with the NDC, especially with the one-time premium on chroniba. How will we be convinced that the muking mubambe?
Under the one-time premium, no, the NDC promised one-time premium. That is true. By a buy, no, the NPP for a can't say my who did no. Send entiza. I didn't know my who did it. Also, health insurance, no, a year juma. When the NDC came to office, what we came to meet, no, national health insurance. I'm stating it here on your platform. Yebeshia mutual health insurance. So, modish haya sokwa ana subin.
High subin.
So haya subin ya. What rest subin na de kwa sokwa card no bi enye.
See that was the problem for you. Any problem amusha.
No, because untimi enroll one time no wa abra de no ponya national in nature. What you say? So we brought the National Health Insurance Act. Yen there is some rather by of 2012. And it's a creative fund. Send your beya NHRL no. National Health Insurance levy no e be feed because you be who say you buy no say the another day no more ye fa ho say dede bebre ho no say na sika kra na attach kwa bi ni ho. So we have to create a fund for health insurance.
And no moment to enroll the one-time premium.
Exactly.
Okay.
Because we need designated funding for it. And you know, because the NDC and Mahama, ye nye boslim ka nkrofo. Ye dwena de no ho, ye susu ho, na ye de ato nsane so, na ye hu say, oh, ade we de ye ni see ya, say de be ye, Ghana for mo so madwen kire ne say. Nti ye hu say, e ka se ye no a, oman ni beboto, yapom de ne betete apansam.
But most people don't know that because they be it's accusation bombo.
Because NDC ye nya nkrofo ye dwayanum. Asem ni nyina no.
You are talking to Ghanaians. Omo go to abanti say 2016 e bia kotia ma.
It's a mistake ye nya bio.
Okay.
Ye nya bio. Niema ya ye me say NDC is the government with the highest expenditure in health. Mbocho mami misao. Mfie nwotwe asupiti ba ko po say ya omampanyine kufuwa no raba omia esi awia oma complete. Obetuma bobi edin akira me.
Yento aso.
No, they be senior yenemu na wo krom a enye yento aso. Me bi se wasa obi se me yiwa no. Bobi kire me. Asantema yitie. hospital baako say MPP aban ba ye mfie nwotwe ni omasi awie nipa kom
from scratch ya omasi
awie nipa kom omo na si ye mfie nwotwe ni mame baako men sorry as am ngrata akọ ebi ni ho
okay
so NDC ye nwayanum nti de ye kan say yesi ye nsinsuo mo ansan ye ham wo ham no asim se ne be ye nsuo no mfa wo ye has aniema na ye the health insurance levy no with it through the act no the National Health Insurance Act na ye buy no Act 852 and ye be tato and a creative fund NDC time no yan cape health insurance disbursement no the MPPI and so ma cape sika no it's sika no enko
tumba mo on cap
we won't cap it and the money would descend down to the health insurance subscribers no scheme managers no ne omo provide you know
ensan koyese possibly ebia musu munia bemunti per what you told me about the one time premium no ebia mbeba na picture no so ntesa then it will affect the musu proposal mo dia be
and then you know ya hunu say ye ja MPP for nko am mo the economic figures ma ya o man be bo so kai say honorable Adongo no catch say the finance minister ba kono ye no ye creative accounting figures no what the BCA no the BCA say na be ya economy no until so man time them say tom and ye hu say say o man say abo say this time round your finance ranking member on finance and your minority leaders in parliament are very vociferous e won so mo de niam bebre asie ye ba ye nim say eniam ye be hu no bebre sikasem bebre e ba bete de aprosin say nanso yenso yewroma hunu the real state of the economy and no guide ntina ma ya measured in your promises no
so Ghana should look forward to this primary health care descending to
exactly
the ordinary people yes
and ya ka say primary health care no e dey on the health structure no your basic level no your traditional birth o dey fa from cry traditional birth attendance unim say prayer camps nyina mo e constitute part of health enipa bebre nim asma making minim say ahwe bi bejima no asibone but no nyina from social determinants of health they are non-clinical components of health. I'm a medical sociologist and a public health person. I know what I'm talking about. Any other clinical dimension in the traditional birth attendance, spirituality healing ni nyina yes our part no na waba a chips compound no ufriwa na waba health center ufriwa na waba polyclinic ufriwa na waba district hospital afeno waba regional hospital no near secondary healthcare no waba tertiary hospitals no near tertiary teaching hospitals near. What we are saying is from the basic up to the polyclinic we would incrementally we'll make it free. How are we going to fund it? And I say a part of the be free because this time President Mama is very specific on Canton now a bit family planning at the basic level at the health center at the chips compound we're going to make it free. A bit is default tracing a bit immunization and vaccination pentatran money at the other well because when I say we're free that but your associated cost to be
totally free totally
that is it.
Ukwaye nyo sempo enyo teku enya ukoyi card for we bia bra bi
ni say yeah and this is free me am a person I don't prioritize so much free if it's not backed by data. My culture say Ministry of Health budget only 24% of that budget comes from IGF.
24%.
Yes. In fact, donor funding 18.4% this year. 15.7 billion American once you know. The chunk of it comes from central government.
Okay.
And there is a little 0.7 come from that, I think the ABFA annual budgetary fund. It means that Sikana 24% is naturally going to 24.5 or so percent it's naturally going to be the shortage which government must look for money to fund it. How do you look for money?
Where?
If you uncap the NHIL now, money will come.
Okay.
If you uncap several of the car, and was allocated to statutory bodies now, abaya centralizing no Ministry of Office of they how comes no down special D and development D. Say how is it different from the Ministry of Local Government?
Okay. Friends saying rules no na omo intertwine. Friends say double rules and they play this
exactly. So you need to uncap that money so that the money that will have to come must come down. You get a point? Ministry of Urban Zongo. Why can't you? For the Zongos, it's a big priority. But that ministry, you don't need to create a whole ministry to give them people. You can allow the same sectoral ministry, traditional one day. I operate it. Makajo Mampenye Kufuwa Donkwa Sikeya allocated to his office why 212 million cedis. Ononkwa individual no the office. Enya Oraba Amiadi yo. Enya Primo Nana Mami Fremo Paradio. Enya Ononkwa ne the ene 212. And it is the last year now Office of Government Machinery budget 4 billion. Now a few way and now I am for teaching Omonsa say hey yamamu wieskani. And the money is no much about 207 billion. A child say bet my be found. Difference in say almost 1.9 billion. 2022. Mesena on budget near say 4 billion. Afiwe ayi can do omunsa nintina say 2.07 billion. Eye dan na enema ebetimi aye no. Omusi ebetimi e the 2.07 billion aye. Aye, me pesa me no a reason up.
Yeah.
I feel can say 5 years no I can say inflation abrabomu nsemo. We were still under suppose COVID DNDAO 2022-2021. Now 4 billion plus Office of Government Machinery. Eye then I am for dia baba ya hey mo hwe ni na mamu niska no nyafu Office of Government mutimi reduce about 2.07 billion. Senior Bunkonta no say na aka
so what kind of sad then people also ask questions mosumbedi abemu no
there are a lot of President Mama siken Office of Government e will do 1 billion.
Hold on. There were a lot of nyama this time mo ba no mo yense kaye mo yense saye because with minister the number of ministers are more it wasn't previously like that. You hear nyama bebrebe mo say masesa and amoba. So once governance is continuous and then we learn from our mistake. Can't we take it from that angle too?
That angle, only part of what you are we learn from your mistake. What bomb manaka me Pentecost elder. Some many ya my boss too so mo catch ye Pentecost for means speaking ma Pentecost sorry. Me say Pentecost ye jinsem bomb pie boni for body. Some na we no mo ka say Pentecost of way. Momra ye pesi ye si aso da kakraka o man mu nyina ye mfa mere si kumase ne ayi Ashanti region, Eastern region, Kwam ho baby, young judges for die. Me Jima sorry penny for invite Pentecost National Political Chamber. Make a humbi. Yami Admanche by your conference, Cassia Power, go more next month, October. Me think here, me, na personally penny for me, Jomudi, and Kiaba, yes, I am.
I see.
What could bomb Mega Krakaway, the biggest hole? And Nam said, Nadiami, Yazam, and hypocrite me, bo Yamekrono. Akwa de malaka kai mo be wia me say wia me nyame me nso me de enti sika no wastage bebre wo ho a if we align it ye be di be ye we.
All right, let's get to education now for the education. So education there are a lot of things
na me come say man ka we na wi
education yes
enti aba primary health care na ye wo post delivery care of mothers ye wo contraceptive pills ye wo care of children and on your friend 7 to 28 days, that's neonate. And you war the malaria case management. San yemani nyina a part of type of services are render is already rendered, but a be part of the free primary healthcare component up to the polyclinic level. Okay. Yeah, very specific in our. Yempesi ebe odi betu ma fe say the MP before that no. Unim some gas on besi apetese factory kwa brace out. Ejuma kazi specific. because and then me who baby until we are specific say be you do ho na media man who be saying what can say any say
busa so de bebusa
yes until they are specific you know primary health care in the short to the medium term up to the polyclinic level.
All right. Your education. One of the contentious issues the free SHS. Yeah, and they maka ho ensema hodo bebre say mobile free SHS no mobeshe mo kena na mobe produce a lot of infrastructure to cater for the spillover na ema yenya track system no be track system dey free honum afi ye ba omo feeding in krone ba mo ebe decentralizing to the headmasters omo na be kodwa so na ma look out how is it going to be done in the first period no. Are we going to have these problems? When is that way? No, the double track system, the expansion of infrastructure, and what have you? No, when is it going to be? Minnesota education. That's why I'm. How is it going to be done?
Yeah, I mean that's it. NDC. We have a track record. Do you know the track record?
No.
As far as Ghana's constitution is concerned, NDC any this shame. Article 25, 1, 2, 3. And there's Article shame Article 38. So as far as education here possible, no. Free compulsory universal basic education, FKIP. And yes, I can see we FKIP na. You have my education here progressively free. And you better take all effort, even up to the tertiary level. You start here FKIP no. Any edition must say FKIP no start here. Even make sure in 10 years of its implementation, you know, we realize that the constitution, you say, the first parliament, which is 1993, you passed a regulated constitution was 1992. You have 1993, MPP for no one count. Constitution you draft. We say, person drum for ma and a bet share the Ghana for yet because we book long for, and so book long, we book long, Papa be and the betray. In 1993. 10 years, no, ever be do 2003.
And a former president go for be implemented here.
Exactly. No, we have implemented the FKIP.
Yes.
So we need to get another level. Now, how would we address? John Mama, His Excellency, started the free progressive education in 2015. Yeah, I'm person debate no. We know the Mampanya Kufuor never started free SHS in wholesale.
It started how?
First year no started year no. Near one chrome was second year, third year. Were they part of the free SHS?
No.
How do you understand the word progress?
Agakrakra.
It is one cartoon crowd sukum. You form 1 for form 2 for form 3 for. Now so also started form 1 for. Form 2 and form 3 for at that time no me here for.
They were part of the school.
But you started it somewhere. Is it progressive or it's not progressive?
Progressive.
Good.
But education. Maybe busa some before you continue. Education and him say policy be a bar. We start from the beginners near the Akwako we. Yes, a year, 3 years, 4 years, and as if we. That's how it started.
Yeah, Professor Joseph Uzana yes. Committee report. And nothing around Mama started 2015, no? I think Nyanya knows, so I've forgotten the school where he launched it. There's a plethora of reports, videos on it, on several TV stations they capture. Now, you won't say, or started progressive, day students, almost 322,000 students or so. And then I'm for about 2017. And also started progressive now, no the board in here, they account. By the third year, no. No, we give it out to him. Why are they? The question is, challenges are is because there is no designated funding for
free SHS.
And then I make a track record. My memo, Act 581 of 2000. We didn't act another cray. Get Fund Act in the Dino. And these are one of the funding for Ghanaian schools, building infra, and that's our funding. We know, almost the Akosia wa MPP the Akosia wa almost 50-something% of that money is to service debt. You really see track record I make you make a buy a track record about educational funding. About 2011 you who's a Debbie. And chronic cost school no chili. And this woman chili over there. The OCA and say, and what's the me creative funding? And the student loan trust fund a buy. In fact, the student loan trust fund, you know, Act Act 820.
Okay.
Of 2011. And this is President Manu, vice president at the time. He engineered it. He supported it. May child track record because se uka se ukongro mo kwa hayo. Na se bi obi a won pomati abofre mpoda. O de tuoko kra so won fam kokum trom a. Waji tuo na no the house wakum. Sa na owura ba amiate. Oni track record. As far as tertiary funding is concerned.
Okay.
And it's our track on here, we would create a designated funding for the free SHS.
Create it.
Yes.
Okay. For the free SHS.
Yes.
Meaning that
yeah, both for two perfu at the attention because yellow, green, brown track your mukwe. And purely because of Sikasam.
How are you going to create that one? Through what?
Through a parliament, through a legislation. Yeah, the legislation in Yadia, Modeba, and Compass Modeba. I'm
asking this question because we heard from the former president say a bit may implement the free SHS as the NPP for implementing now. It will take about 20 years, or some of your people say that.
That is not correct. Now, I want to put your record. Former president never said that.
Okay, it came from your camp. Let me put it that way.
Do you have an idea whom it came from?
I'll give you the idea. I'll give you the person.
So, because I deal with facts. But I deal with facts.
I'll give you way.
But I want to put a record. President never said that statement.
Not anywhere. I'm raising a lot of objection about how the MPP was implementing it. Maybe so because now we are not ready. Pay what the NDC is saying. We are not ready for the full implementation of free SHS. Are you forced to swallow a bitter pill because about the 20 years
we were not ready for the approach to the full implementation of the free SHS.
That is what I'm the same thing I make.
The approach.
The approach is that's same approach in here because per what the former president said, we can't go back because it has come to stay.
Yes.
Are we forced to swallow that pill because you're not ready but still about to continue swallow?
There is nothing to swallow. Why is there nothing to swallow? Because now it is with us. We have started it. We went with their students. The following 2016, and then the borders the
2016 borders.
Oh yes, it was contained in our budget.
Okay.
You can go and read the 2017 budget of the finance minister. Okay. He captured it. We're going to do that. And yet the finance minister captured it in the budget. Make of California and what's making. And in 2016. So it was already been captured. Okay. But the point is that the way now more approaching anything I make us say constitution say say education progressive even to the tertiary level.
Okay.
Once you free fees neighbor yen wholesale or mine bebo until we kakra problems never now identify, but now we are with the problem. We need to solve the problem. Senior, can you believe that a country your debt over 700 billion free SHS ain't even 10 billion. It's also a minor priority, no. Uraba mi ani akufado enwene yesuku fo no nkra no. So omudwe omho a hwesika twetwe die yi. Me say free SHS sika amudi ahyem enu 10 billion. You get the point? So what we are saying is that because of your track record no, you be created designated funding. Be say get fund, be say student loan trust fund no. You be created specialized for secondary education.
Okay.
So that red, gold, green no ebe twam. Bio ebe aduane sem na de aba we aye ne say one man party for no one more contract, and I'm speaking this as a matter of fact. Ento ho na bia constituency chairman bia na say party aparachi bi yamba ne schools be 4 or 5 on the supply aduane ne bre school no. Almost a national buffer stock. And no procure by no credit. And because minimum go for be no yes no. They supply the food. And to another supply no. A supplier he's a businessman. What I say? Businessman be no businessman day. Of course we make it day. What is it? loss. What President Mama is saying is say when you do that, so pay adwuma wa party mpanyimfo ne ade there are several ways that legitimate bet manya adwuma dey amom but so we ne saa school for no ho dey aho chire wo mu enti no this time round no say first term no na aye bia 500 million and was yede ma miam school Anglican Secondary School yede ma omo a headmaster and one say the money will be released to you. We tell you what the money is for. Now one kasa wako no why dey. Aka procure goods. Unim the NTS agri process may tie into the 24 economy no. Enti no enam say ye ba ye the enaminia prince obrika no. Eye farming activity with ecological zone advantage no. Say if you just abri nyina na say vegetable a year. Eduma senior high school ho. Abana ne eduma senior high school because ora Mr. farmers we omo if you abri no. Omu produce vegetables. Enti mu school ha no mu procure vegetables ne dey enfiri omo ho enfiri omo ho now abai na ebe determine abai will determine the minimum price was we dey o turn but not the maximum say dey be omu ntwa ayifo no akuafo no atwamene so that headmaster no can plan ahead. He knows the enrollment numbers. When ni cook ni matron for no betimi a plan. When you do this, food shortage will be addressed.
Okay.
The other issue in terms of kwanya ebe faswa a year free SHS and ebe man ye na ye kama ora mama so man ye na ye fe ni say ma me example bi on baby a tafwesi or say is it
Wesley Girls
Wesley Girls Kumasi
yeah
on say uko anim kakra na wo branch say wo ba be fa dichem so ho na na private school one friend Faith Assemblies of God Secondary School me dey asem ka keke and the school na gu facility ni si ho e come up so uko baby to say kwara so a na wo fa barracks or military for no ho na secondary school bi ho me ya me masters research ko na me ko data very nice. I'm saying Assemblies of God for so there very nice building and the school no egu facility there dey ewo ho in the short term no kwanya be fa so all the school so be primary college in fact
walking
distance
yeah
in the short term kwanya be fa so be double track everyone say man more example oba a year if you kwa abria ye wa adumai senior high obedura franco a wo dane ho abon say ideal college ewo dan ho omu wa abro say to aso miensa de bia be kwani pa kra bi na edai ewom what the NDC no rama ma can say private schools na ye kama na ben various school you know egugu no we will speak to the private people facilities they sisi wo omu boka omo investment na ye de bibia ada na ye double track ema me mo fasifo mienu wo KSTS ba ko betena fie me ya me na me sign do mo call private was it remedial school
okay
but then feel close to 3 months so we will speak to them send ye be ya be buses amomo and in the short term no all those facilities will be used.
Okay. And with the private schools, that means you partner with private
exactly schools. We are bringing the private school on board.
Now money almost spilling over. I have a man track system.
Good.
And
there one option. Second option there. Quick infrastructure development. Medical $10 billion in infrastructure. Within the first year na massive infrastructure drive. Send ye beya. E-blocks na kemure no. We would quickly activate them.
Will they be still days to school and I say more the boarding I facility be attached?
Some of them no baby drew no I was the boarding be count no. Ye be boarding I day aka ho. Na enti my private school baby a been you know. So we buy a bus for them. What happened is say be a general arts department, a general arts and I make call into international health and medicine. Nti se general student am say mo be collect mo be class dey. E wa ha mu wie ya bus na dey. Abefamo e fam wa day for be kofie boarding for road my day abe school simple solution. 2 infrastructure na akan nwure ma oru aba o miase onye day fa ho no you know the NDC 46 were completed full operational 70 plus where had been started, infrastructure no has started, but the awarded contract were 123 or so. But 46 the fully operational. 76 buildings need to be with different stages. And the contract had been awarded near almost 123. So we will quickly do that, bring the private sector or private schools on board, and in doing so, we would abolish double track. Remember, double track is not only a function of capacity, it's a function of money. And in the first budget of the NDC, you will see that we would express our intent to establish the funding. Then, quickly, the funding bill, will go to Parliament, and then we'll get this fund created to back free education. Free education has come to stay. Free education. Intima mia, me no manso na me free, and I'm a tia for abre. Mammy, I want manso, obana we free education. A year, your mama so about the shem kena. Now what we know, the akano, and no one come on new video.
All right, Enti the computerized school selection and placement system, and also mobile must say review. What is wrong with that? What is so wrong with the computerized system?
Senior. Madam Fubia, me no we fija ko abre pa, we di mu akotere pa.
Odi mu akotere.
Ai, we yam pipi no di mu akotere, me mo ndi wa. He's a fine gentleman. Odi mu akotere pa, we yam pipi ni. Na ye ka me nka so no na ye corruption no. Ye ka corruption na e was hard ye mu a. You be shocked.
How?
Open first class school. Last year, the OTU lowest 7,000, 8,000.
Mintiasi. Na say a computer nessa.
Hey, computer
into open first
class.
What
be a tum, be a
how?
Messi be a feed into over to assume over the sounds. I was some parents never catch
7,000.
Oh my brother, mean town tro. 3,000, 4,000, 3,000, 4,000.
And today na mobe, what will you do? Mobe review the same.
How is it going to be? We will review so that
I nipa krona na better na ho. And that's a difference beba.
Difference beba.
Anything.
Criterion. First, not 30% now allocated to a
public schools.
Public schools, that would have to be strengthened. You strengthen no catchment area for also the also strengthen because so strengthen no afei no nipa na nya school kra wanim se ni school ebe no obenya until reduce the intention to go and seek help somewhere. For instance, some mete aswase na ma pass within the range of passing na you see allocated 30% to mo amote that district no
meaning that 30% of my local this time enye adwuma.
Oh senior. From Rebisomo.
Enye adwuma.
From Rebisomo. So the question is, se omo bay area ho no nya, omo nso quota no nya access na. Afei no, bata na wo anya school kro nim se ahayi de ebe mintima dai. Mema ko hunu mpanyimfo a omo de saa 39 dai. Amo omo na menso mensa dai. Akabi. So it reduces the chances say mami nkotua 30 million, 40 million, 50 million the many first class.
And your corruption and you decentralized because you go home mpanyimfo yi. Yes.
Yeah, I agree. It's like UX. So we contract will be it's approved. Maybe 5% of that goes to somebody. You can't corruption. Make topic back on make sure corruption in public sector. Corruption is a matter of law. So idea we you need to say na ni ene sa me just say corruption.
Say you nanti emphasis ya makota. That's a nipa kro no kura quota no or the giska yin hu say corruption.
The quota na mrada ho.
Okay.
Yes, quota na yemfa manti wa wo de no. Yes ko hunu nipa wei. Eye quota. Mo nyina mo form application enkomo a mo te ben school no. Mo form application enko a we anya school no. Enti ukwa omo selection criteria. No ma ye na we go through. And an affirmative decision.
And no ebeyi eye corruption every ho.
Ebeyi part of the corruption every ho.
Good.
Enti me nyina every ho.
Okay.
The other issue is also about the bottlenecks. System na nkasa no. Criteria na saying. I was yetimi ma criteria transparent enough. E dey na betimi am wanya admission akọ Anglican Secondary School. But we parents say unu bi akọ secondary school and I say o baby. Unim criteria nti am edne to we edne to ye no.
Meaning some selected schools, you know.
On the basis of, apart from so selected school, no.
On the basis of say your grade no. Possibly the choice of school being first class, being second class, and as if for no.
Grade you grade say na unya do be call first class school.
In fact, it's not clearly stated. Because you nipa bia omo nya that grade, but they are in that school as well.
So that is the issue. When you are building a policy, you have to make it transparent. So the NDC is going to make things very transparent. Yeah, because okay, or first,
first class
or first choice school now choose you know. And create try because it means that mrano ahead because him performance because sometimes a performance no be making a be determine. Yeah, we are create traffic or average score you say. You get it?
Cut off point, beba.
Cut off point, for first choice, for school, no. We will publish those information. Well, choose Anglican as a first choice, More choose science, science and crown, or more average score, no. Be 500. And the acronos what mean a raw score. And two banners or raw score, no. Average in 500, now raw score 450. You don't come and blame the system because we need someone your day. Unqualified. Me know why we don't know that. And once you school day.
Or
Or fire. But be no obi enya 18. No on the first choice. Obi enya 7. We enya the first choice. Is it equity?
Okay.
Is it transparent?
That is where I'm free.
You said the rule with the fairness.
Or the highest win. Ako baby or person
exactly.
Okay.
And it's a nipa 500 na Anglican school. Only school be me wie. Nipa 500 na ekọ science for no ye be 200. Omo select science 200. You share science for no. Omo best 4 no, which is over 400 no. Average 380. Science no ye betimi ankan so betimi afa nipa 180. Enti no omo raw score average near 380 dia. Unya 350. Untimi nya science e wo hene. E wo Anglican Secondary School. Parent no raw score wunim oba no unim ne raw score. Akwani nim ne raw score. Onim say me choose Anglican first. Me raw score you say 350. Anglican for science almost one raw score no.
Last one here 400.
Last one here 380. Akwani will not be disappointed. Maami will not be disappointed. You get it?
Okay. So these are the name I'm best saying.
That is it, and it's basic and it's simple. And then nema
I see. To cut down corruption,
to cut down stress
from parents.
Mommy, what you do? Bounce over your science one can school. Obani 200 score over 400. Ye na ye hear mum choose Anglican no. Science for no. The onya lower mark require 320. Average no you say 380. Into Obani 200 no. Enye.
Okay.
And to be whom me doctor appear say me call me all student wa class ya enye ye make out the 30% quota no ko nipa omo da no omo nya dai omo wow.
Okay, me anko STEM TVET any in krone ba no mo de no be different. How different will it be from what the MPP is doing?
I'm not aware of what they are doing. What are they doing?
Some more STEM schools, more TVET schools, yeah, almost
STEM schools.
Now they have 10 of them.
10. Fine.
2 or Ashanti region. I can mention 2 here.
Fine.
Ebi wo Bosomtwe. There are another one. There's another one.
I think Bosomtwe dey na me mate ho asem.
2 ha. Mame penny na.
Yani be steam.
Be steam.
Yes STEM. Minister.
Minister STEM na matro ha.
Aye.
Matro STEM ha.
Minister current minister can want some steam. And also steam ni yes onye science, technology, engineering, mathematics and nko a. What the arts and so dey. Ebeka. Because arts and the creativity neba. Beyond the science there is creativity. Beyond the numbers there is a story.
So how different?
How different is about the priority. The STEM or the STEAM would not only prioritize Omoko High School nko a. There are so many people who didn't get a chance to go to high school. Chance and go high school. They have innovation. They have creativity. Bring them on board. Train them. Equip them. There's a role which may play on my name. And the NDC, and yet the formalized group no kwani ede.
Mosho.
Yes.
in the school no you have people omantimi
omo beba besua then they go back. I get to the point. Because on my teacher no me we secondary school me tena fie afe nsa na me call
tertiary.
Tertiary KNUSC. I am a first and second degree. Me call me other PhD or Germany Nigeria and South Africa. So what do you say me na me nisika am de be call. Me nisika am de be call university me tena fie na me people teacher. Obi o ha hwe magazine fo yi mrantie bebre sua yi. Why don't we create a system curriculum? And that's what the NDC is going to do. So that center of excellence now you be creating a region biano. These guys will come and learn from the center of excellence.
Okay.
Science. Science is not only about pi r square or what is matter and what is technology. Innovation.
But was the be purely practical.
Practical. And the also theory, the change theory, and the also because obuha obesuya or the paper back to industry, right? Obi suya obe progress it to the next level. Say obe call higher levels, and the priority will also be women in science,
Okay.
and technology, engineering, and mathematics.
Okay.
Because it's a huge. Someone is here the first running mate, incoming vice president.
Anyway, right. And then man doso. Oh, then man doso. Me I share the job.
Let me
creation,
academic,
yeah. Oh yeah. Me I share no answer. Yeah, free, stress-free user fee.
I know the
academic user fee. No.
Make us say me baby project.
When are they buy?
Nyame na me dey buy. President Mama na dey buy.
But when now yeah,
President Mama na dey buy.
Okay.
President Mama na dey buy.
Yeah, how feasible that one is.
Me no answer make us say me we school no. Me tena fie. Na me people teacher. Child your private schools be very. Is kasem. But me kasan chance and my mama. Obe we school. Akwa SHS we. Kroma SHS adwuma be na betimi de aye. Uwi a. It's a private man be found in school no why dey. Achira dey. But akwa ni timi kopole. Ana Technical University. Otimiko Training College, ana College of Education. Otimiko Nursing. Wonso benya krachi wo fie. Eno na ura mahama adwene ho de ba no. De pese ye ne say. Your friend de bi gross tertiary enrollment ratio. Nipa ewie secondary school no. E was en ko university no. Me no ka say Ghana ha. Oha munche 19.11% enetimiko. Onsa reho pa. Nipa wo mfie 18 years to 22 years I was en kasabre omo university no. Uyi Ghana mabunu bia enum eduru ha egu ha. Emu ba akopɛ na abe unso watimi akɔ tertiary education wanya bi. What is how to my amane nya den. Enye yi. Enti ora mahama say aden na afi we nkura ekotwere nso we nko a wo high school no. Eye 461,000. Afi we nko a
461,000.
Yes.
Yeah.
Ba ye be wie no. Na enkura enya kwan ko school no. No mu ye kakra bi. Enya de eboa ma oman chichiriye. Ekoso. Na ye hwehwe mu no, ye hwehwe mu na hu se ade ba ko edi omunya. Eye, fa me kono. Sika odi be wura mu no. Omunye sika mfa wura mu. Enti obi kura ha no ho mpo nto forms. Me be ye constituency chairman yi. Kofu bebre ho amia ma support o ma to admission forms. Amu omu. KNUSC yo ayibi ho a Mastercard se unya wapase na wentimi yanko school no afiwe ya ebia uwi afra se wentimi yanko na afiwe ya afra se na afiwe na abekọ na pass ya utimi apply na Mastercard for no omuhwemu a no mai dai o ma fa no ma full scholarship o ma hunu se biribi ntina ha ma wanya dai anko school to ra ma adwen ho ne yesi o ene ye be ne dai ene yesi okay ene ye yenhwe nipa dodo sen ye betimi aboa wo. NDC ba ba mu. Medical card NDC your track record or tertiary funding. Student loan trust fund.
Okay.
Me see any de buy. So ya way. Makaza get funds any de buy. Na mpo ye pemu na nke benya na nka obi a okotehye public tertiary ayibia no nka obeko na nso ye ne sa ba bia kufu ado ne ba o me ade o man sika kodu no obebo o man say to enti ye ka public tertiary na mami church me Ghana frontiers yi eye schools be ya public tertiary no de di kan ne ye public university Ghana higher mark 16 de toso no ye public technical university ye 10 de toso bi ono ye colleges of education ye wo mark 46 aban de toso bi ono eye nursing midwifery and also no ye mark o my money 140 but aban de no ye 81 and 81 no emu 6 universities UHAS, KNUST, Legon, UDX, UNE, akabako, UCC. Until 76 and a year are buying public nursing. And there were colleges of agric. And it's your bear 4. And there were public specialized institutions. And also, and I said, dear friend, yeah, public specialized institutions, and also, now, Sika ura mahama betu ya, also will be out on school fees separate.
Program biazo nene de.
Good. Enti also we yes an konta no. Wa anya san konta na, we yenhye na enye yi. Ura mahama wo 3 cost estimates out they run the program no. Metro ni nyina mu. Cost estimate edi kan no say. Wo fa Ghana Tertiary Commission, omo na ye abegyaku a Ghana ye tertiary school sem nyina mo hweso. Omo report omo ye eye Professor Salifu. Mo na ye sa ayi na report na. Omo kire se afibia no Ghana nkra ekọ aban tertiary maka College of Education private nursing for teacher training for omo technical university mainstream public 16 no ubu ni nyina nkonta ni nyina na yewo first one senka sa number na ekọ school na ekwa na odi omo wo afiwe 2024 2025 ya ebe start January no
omo wie school
omo be kono any be atifie ne be kono we ye nkonta na ye hwe ni mu se enkra maako 155,832
and ebeko school tertiary we fancy private public tertiary school institutions okay
no omo be ko hene me be no numbers no
before that said you okay obi ha auto from grading na mo the policy abay it was well
mtina make us ya estimate me ensa me be chew ni nyina
okay
enti sa policy we no sa nipekuo ya me kan ho asemi no se wo de normal one no kwa sa 155,000 no ya adwene se aban tertiary school na ye 16 public university no ya calculate will be a school fees enye academic facility user fee academic fees pamichrim ya academic facility user fee na only one component of the fees just around 20 to 21% of the total school fees no mamenza nkebio say residential fee nka ho school fees na ye gi akora no wakono on say president mama oye no kwafo on kan tum sa you see school fees na enye 5 million ho asem ne yebe ka for example KNUST omo average school fees for all first year program ni nyinaa no is around somewhere 2,200 and something.
Okay. Averagely.
All first year programs. 2023-2024 academic year. Okay. UDS, Nyankwara campus. 1,804.23 cities. Okay. University of Ghana. Program B, how the program B average? Around 2,300 and something. UHAS. You're running numbers in Narabo mono. They all call 16 public university no. Onono Sikano ebeyebe 2,350 cities. In fact, they are 2,354.92 cities.
Okay.
Only a public university. And a technical university for them. In fact, when him say technical university credit school fees 1,007.
Yeah.
But you cannot average. Send you be the school fees what form no. Ever study in school fees here. I was wrong so.
Meba no watwaso ba men kan messages kakra bi meba na juwa home kakra na ba watwaso e wo hanom we ese yefa we entudwa enfamam we say good morning. He said the okanyina and say good morning. KOD John Mahama thinks we teachers have a short memory. John Mahama, teachers and nurses, we don't have short memories because during you and your NDC 2012 to 2016, we teachers, we work for 3 good years, but receive only 3 months salary. Now, John Mahama, you need power again. So, you have promised teachers and nurses again. Mr. Cancellation, man, John Mahama, we know your track record from Prince and Kransa, Bono East, and Odiwe, Abrain, and Anopay. CKOD, it was their former minister Leokra Neka a year 20 years and one said someone or a press conference and or this answer way at Tudra, who said free SHS can be feasible in 20 years time. We ola aguna and do we abaye and so honum. And we as security tell the NDC man that Chips compound was not introduced into the country by Rollins. The name was dispensary, and it was set up in every community. Cocoa Route was before then called Feeder Routes. They are only experts in name changing, daggering Amsterdam, and or the way so a brain. Now, security tell those NDC people they don't have anything good for Ghanaians. It's better for them to shut their mouths because my daughter is in free education from Daniel AJ, South Africa. And so or the way abai and STEM schools no so mama mo so answer make say make ka honsem e wo ha STEM schools no so say ATM kwada so na me pende na one kwada so ho daba awaso abomusu akrodie wager and percent and so ho na abosom twede no so ababeka onti na de onti mama ti wo ne na wo ka no ehom
nipa na
ye snappy mama
enti no say normal stream no nke nipa e kona say ohwe nursing for nso ye omo analysis no ye hu say omo nso average school fees no e 3,000 in fact me no ka say I confonochi here they are paying around 2,100 or so.
Okay. In fact, averagely 3,000.
Yes.
In total. Every year. How
in
much
total,
no spend?
So the first option no kwana nka 308 million pay.
308 million Ghana.
And that first option. President Mama onye sa.
Okay.
So it's mention in terms. Second option they say. You heard him say. And create a quatrain so he. Omo 461,000. Afra say 69.97%. And then ya 86 ewo core subject no. But unya A to C6 or core subject and don't have access to the public tertiary. Just unya ha 3. Na when you elective into 3. Na sa numbers you hear no total na nya sa numbers no enu 60%. Omo munya passes in 3 electives and 3 core no enu. But yampo the ya say 70% of enkrana etren so he afi we no omo 461,000 no sa 70% ebetimi pass in 3 core and 3 lective sa 70% no ubu nkonta na ebeba ba be si 312,860 students.
Okay. About
322,428 students.
Okay.
Now, fair no, San Crawford no, nursing for Sena, Ebewum. You are buying nursing for no colleges, no study Americano, Yamako 81, name of 6 year university. And it is our 6 no, on fees and also with the film. Not 76 in Ebekano. Ya Zumi say, first year for no 500 students, Ebeko College of nursing training be a me no can say nursing training no more average no and number 350 first year for no and to multiply omusikano by 3,000 na omono ediano omono be mayen nurse for de no nko ano ebe mayen eye 45 no ombe 50 meba. But mommy,
my figure ni
me my figure ni. Nurse for no medical ga say average school fees in here 3,000, right? Enti yewo sa 81 na overall na aban die wo me say 76.
Mama has students because we have a yes can wa ko piano ko first year. Subsequent years and what happens to them? Esika be no fan to us.
Mami mun kunta ni wie na obi wi abohu say next for the no ha. Enti now no. So wo hwe next for no nko ana e be 112,500,000.
Okay.
Because 3,000 multiplied by the number of necessary
first year
omoko. And I say say nursing training be 500. Mprempre no omo average number 350. If 500 now multiply man 112,500,000. Now about teacher training for no. Teacher training for no so no. Omo so no ya wa mark 46. And I Ghana ha. And the 46 no. Omo no. Omo for average of 400. And the 46 by 400 no. Ebe ma ye be 18,400.
Doc, but you are saying me pay the bulk of the money.
The bulk of the money is 504 million. Pay
504 million.
Yes. To cater for as much as 300,000 plus students.
I don't know for private tertiary institutions and count. Me can't wait because of more criticisms about the free SHS. Say it doesn't include the private schools. I don't know for count. More consider. Why didn't you consider those people as well?
NDC. Ye yankrofo and ora mahama ye obia. Drink anymore. In fact, mimpo there, we got private university for no, only 12% of the total enrollment public according to the GTech report. And so guys all the omo kanwa. Omo numbers no is just let me get a figure. Very small figure. But ye pese ye ya de no na emo bro ye so emfoforo yen. Also ye starting no 2024-2025 academic year. Nyame ya adoma ye be go 2025-2026. Me gidi isi ye ko ye nimu.
Ebeba.
Eye den ye ebeba.
So I was on because my projects are my year for a period of governance. Me fan say 4 years no. And I'm there to do. Te ye bi ankamaka first year bi say second year na third year there. Near the private universities no and I say tertiary institution na be ka ho.
I know a good suggestion. Name mo prempre no. Ye started public no. Ye mpese ye be dia to check Ghana for. Maybe your mind drew no.
I'm taking this
credible leader
because of your criticism. Ghana for refer to you because you criticize the free SHS. Say you am far a year private schools now. That's why I'm asking this question.
I agree, but I'm also saying say yeah, but you say SHS and you do more be count. We're gonna bring the private on board. We have been measured in that. Yeah, analysis no ha. Ye hunu numbers no. Ye mpese animu ya no. Ye do more count se sia. Ebe good private. You know, what is it? schools, you know.
How? A big good system because now because you are going to pay into the private school.
Anything I make sure say for now, no. What we want to do, no, they are in mind, but we need to sit down. Also, they are business people. We need to sit down with them. Know, and there are different levels of private investors. You are faith based. You are individually owned. For instance, some person okay say what the Pentecost University back on board. A church of Pentecost there. You get a point. So, but okay say what they a different private investing so back on board. Every individual be now like Kessben University
College, yeah.
If you are bringing Kessben University College, you know dealing with honorable lawyer. You know lawyer also completed Anglican Secondary School. Only need deal in terms of bringing on board or your individual now where they. When they deal, so we will certainly we've considered that.
Consider winning.
We have considered that.
Because they also ask questions.
Yeah,
why aren't we included? People will ask, say, I don't know private school for the private investor is the informal account.
We have thought about them. I've told you, sir, their numbers in terms of per the report, 12% of the public, their numbers are easily doable. But YMPC overly being out there, we want to be measured in our promises. And say, Orama already an American looking at the total number of students.
Obi criticize him on that line. He's okay. So Obi criticize him for private school, private investors and so
for now, if you criticize it, it's a fair criticism.
Okay.
But we will certainly include them.
Okay. That is the clarification. I mean,
we will certainly include them.
We have just about 5 minutes left.
So let me talk about the funding. Free. For now, two sources. Make course say over 300,000 students.
Yeah, okay, but the last one about 500
million.
Yes.
Office of Government Machinery. Budget as we call it 2.07 billion. Ononkwani office no 212 million. In fact, budget items one the office near 26 budget items per budget line 26. What the NDC will do, will realign that one and take just 15%
out of that.
That will give us 305.
Send a mokwa realign. And some cancel. How is it going to be like?
Every day cancel because near money be ministries never my year because say echo the Office of Government Machinery. But the year see 15%. Any year free 26 budget lines. So you divide the 15% by the 26 budget line. What do you get? You get around 0.5%. Enti say impo yen yi bibia mpo mfiri ho a you reduce each budget line by just 0.5%.
That easy?
Very easy. President Kufuor hono nko ano. Say we reduce ono nko ani office we reduce by 212 million. We reduce by 0.5 now it will just be 8 million. His 212 million budget line by that 0.5 it will just be a reduction of just 8 million.
I see.
How does that affect? You say, President, why? And that is going to give us 305 million.
Nobody aye.
I know.
Me sure say we be be akase o asam na ye kan na
ko be President Obama is a credible candidate.
Ma ye na me say yan kabo manzisia ni nti ne yan twetwen so ka.
He's a credible candidate. Tertiary funding, materials and these in a day get funded by. Materials student loan, yan ye by 2011. Materials here the student loan plus e ba se na be akwa ni wie first year no wura mu a school that no ye exam si mo di school fees ka first term no first semester ka say bi ntua half when ye wura mu ne de wo be wie wa wura mu no nyame ya adoma loans or scholarships bi ne ade and the student loan plus fund no they say student loan no ye ma 1,500 to 3,000 ye betum sani ye betimi cover o fees no because my average school fees say 2003 and you bet 2 mama na bro the average school fees no say na be ya woji abetimi na dey student loan akotua second source of funding no the get fund we will take just 10% of the get fund 10% per that will give us 393 million add 393 million plus 305 million that give you 704 million.
So when you win now, why do you wait till now?
time and chances happen for a reason. A brain ma de ye. Ena a chere a brain juma asudi. Ora mama can say bi was it the time and the seasons call for radical innovative thinking. So that gross tertiary enrollment now 19.1 no, you be increasing to 40% now. Yeah, by 2030 no.
Okay.
Yes.
Okay.
And this is the way to go.
Ti amanfo chairman sama be dia ba mu bentemu ni nyina na wasa mo ye no manye nti ebia mu janse bia na munim de ye nti manya. What answer will you give to Ghanaians?
I'll tell them that you know say school for tertiary no mo chire mo the student loan trust fund buy. Ye ne de buy. Ye de about 2011. Ye de buy ne hu say there be still necessary student loan trust fund plus. E buy. What do you say? Ye we ne hu say there be school no kra no mpo na bi ni won na manfo anya akọ. Enti Yensi University of Health and Allied Sciences ma mo. Yensi University bi o so manya University of Sustainable Development. Yensi mo. Na you Martin so Yensi, I'm saying okay no campus. By any man presidential charter. Yensi. So you get a point. Enti no, your track record, your you there, your you has. Your so many idea ho. So we have to build the infrastructure base. Na ba be so.
Okay. Dr. Christopher Yao Apia. Emrena my kwam yenwurem nyina.
Ebenya bro na ya say about.
Ebenya daje na yenwurem. I ask questions based on what people are.
Oh, it's good.
Saying.
I mean,
yes.
It's good that we get some of these things and clarity is one of them. Ma me fa kwanya na me sre me nuanom asanteman emma me sre mo. Oba we secondary school no. University for any nursing omo ton forms. Ko to form ni bi. Na wo ban so nya krachi ni wo fie. Ora ma se onni sika wo de betu akra January ya oba nya admission ya usuku fees no ora ma befa kotobio na wanka say NDC for yanka
All right.
Poly anak technical university for form no so ton KNUST form ye ton college of education form ye ton konne kotobi ma me won so nya krachi ni e okura degree wo okura diploma wo ye nurse e wo fie Mr. Okoneko Toby.
All right.
Then this is in Shepeba.
Let us say Dr. Christopher Yao Apia, senior lecturer, KNUST and NDC chairman, Efija Kwabre South constituency, and I'm in AD and Common.